Welcome, everyone, and thank you for joining us for today's OnBoard limited release webinar for healthcare providers. Before we begin today's presentation, I'd like to ask everyone to please keep your phone lines muted. At the end of the presentation, board and project leadership are on the call to answer as many of your questions as we can. To submit a question, please use the chat feature, sending your questions to all panelists, or by submitting your question in the Q&A panel. And just a note, we will be emailing you all with OnBoard limited release resources for healthcare providers, including a recording of this webinar. To begin with today's agenda, I will now turn it over to the board's Communication and Outreach Manager, Pam Barnhart.
Thanks, Mike. Welcome, everyone, and thank you for taking the time to join us here today. Today's presentation will begin with a condensed OnBoard limited release overview for healthcare providers. Next, I will be detailing what each type of provider is able to do in OnBoard limited release and lead into the main focus of today's webinar, which is how providers will register, access, and manage roles in the new system. I'll walk through the latest FAQs from the provider community, let you know what you should do next to prepare, and then leave plenty of time at the end to answer your questions. So let's begin and dive in with a project recap. This multi-year project initially began in the summer of 2019, with the full system being available in 2023. But we identified opportunities to implement some early process improvements and functionality sooner in what we are referring to as OnBoard limited release. OnBoard limited release is tentatively scheduled for release this summer of 2021 and will include a new online process for prior approval requests, or PARs, as well as the online submission of Form HP 1.0. On January 24th, 2022, Phase 2 will be available, which includes eClaims EDI 3.1, with the complete OnBoard system being available in 2023. To transition away from paper forms, limited release will move the prior authorization request, or PAR, process completely online and will include the following. The existing MG1 process will be known as confirmation in the new system, and will be confirmation that the treatment the provider wishes to deliver is consistent with the medical treatment guidelines. Confirmation is optional for providers, but if submitted, will be mandatory for carriers. MG2 will be known as variants. Special services, which includes the 12 medical treatment guideline-related requests previously done using C4 auth, and greater than 1,000 will be used for non-MTG treatments costing more than $1,000. After a transition period that the board will announce with the effective date of OnBoard limited release, paper form MG1, MG2, and C4 auth will be eliminated when use of OnBoard limited release begins. Part of OnBoard limited release will be the introduction of a durable medical equipment, or DME, fee schedule, as PAR submissions will be required for some DME items. The DME fee schedule adoption of amendments were announced on March 4th, 2021 in subject number 0461379, and the amendments are scheduled to become effective June 7th, 2021. You can learn more by visiting the regulations section of the board's website displayed on your screen. In addition to DME, there will also be PARs for non-MTG treatment costing $1,000 or less, and new medication PARs, as OnBoard limited release will be replacing the current drug formulary prior authorization request process. OnBoard limited release will also digitize and streamline the submission of HP1s, requests for decision on unpaid medical bills, and healthcare providers will submit Form HP1 solely using the web-based limited release platform. I should note that the rest of the HP1 process will continue using the same procedures as it does today. Only the initial submission will be done using OnBoard limited release. Submitting a PAR begins with logging into the medical portal to access OnBoard limited release. The dashboard serves as a homepage in the OnBoard system, where you can sort the information by column to view the status of PAR submissions in progress and submit new PARs. To submit or draft a PAR, healthcare providers or their delegated staff will select Submit an e-form at the top of the dashboard and enter the requested information. And as a reminder, healthcare providers can assign delegates to fill out PARs on the healthcare provider's behalf. For example, a delegate may be office staff, but the actual submission of the completed PAR must be done by the medical provider themselves. You would then enter the required information: PAR category, CPT code, MTG site, body part information, and whether the requested treatment is consistent with the medical treatment guidelines. Reference documents can also be attached, such as medical records or progress notes. There will also be the ability to add additional PARs on a single submission. For example, a provider may want to submit PAR requests for a lumbar fusion, post-operative physical therapy, and a back brace, which can all be added and requested via a single submission. The PAR is then submitted to the insurer, and again, the actual submission needs to be completed by the healthcare provider themselves, not their delegated staff. OnBoard limited release will feature electronic submissions of Form HP1 and the listed PAR types here. Different provider types can submit different PAR types, and the system will enable the ability to submit various PARs depending on the provider's registration type. For example, in the first row, acupuncturists will be able to submit Form HP1, non-MTGs under or equal to $1,000, and non-MTG over $1,000. Please review this chart to ensure you are aware of what types of PARs you can or cannot submit. This chart is available on the Medical Portal Overview webpage for healthcare providers by accessing the URL on the bottom of your screen. Registering for the Medical Portal will give you access to use OnBoard limited release. We will now walk you through who already has access, who needs to register, and how. If you're a provider with access to the current medical portal, you are automatically granted access to OnBoard limited release. When OnBoard limited release is available, you will sign into the medical portal and there will be a new link to access the dashboard for PAR and HP 1.0 submissions and review. Remember, the ny.gov ID that you use to access the medical portal is separate and apart from the ny.gov ID that you may use for other New York State agencies, such as Department of Motor Vehicles and Tax and Finance. If you do not already have medical portal access, you will need to register. As I just mentioned, if you don't have access to the current medical portal, you'll need to register for the medical portal in order to be granted access to OnBoard limited release. The medical portal pages of the board's website contain different sections, one specific for healthcare providers and another for medical suppliers. Let's go over if you should use the healthcare providers or medical supplier section to register for the medical portal. To determine if you should register as a healthcare provider or medical supplier, you can reference the Who Can Do What chart available on the medical portal webpage. If your specialty is listed in this chart, you will follow the registration instructions in the healthcare provider section of the medical portal webpage. If your specialty is not listed, you will register within the medical supplier section of the medical portal webpage. I'll first detail registration instructions for specialties who are on this list and will be registering within the healthcare provider section of the medical portal webpage. If your specialty is listed in the Who Can Do What chart and you do not have access to the medical portal already, you will need to sign up for the medical portal within the healthcare provider section of the board's medical portal webpage. And a quick reminder for dentists, audiologists, and ophthalmologists, you do not need to be board authorized to request access to the medical portal. To sign up for the medical portal, visit wcb.ny.gov/medical portal. Under Healthcare Providers, select Access and Administration. Next, select the Requirements section from the left column. Then you will see the Sign Up for Access to the Medical Portal button. Select this button to begin signing up. You will then enter the online registration page. Review the information and then select the Continue button. The next page will feature two tabs, Authorization Status and Provider Information. Enter the information required within each tab. The following information is required: registering provider type, registering provider authorization status, authorization number, which is required if you're board authorized, New York State license number, which is required if you're a New York State licensed provider, NPI, which is required for all providers, HCS or Health Commerce System ID. You can select no if you're unsure or you don't have one. First and last name, address, phone number, and email. After entering the required information, select Next. After submitting your registration, it will take approximately 3 to 5 business days for the board to complete the review. An email providing the ny.gov ID and temporary password will be sent to the email submitted on the registration when access is approved. Within the medical portal is administration, and there are a few different roles for healthcare providers. Let's define these roles. First, there is a billing delegate role within the administration pages. A user with this role will be allowed to draft and submit Form HP 1.0 on behalf of the provider. If a provider uses a billing agent to submit their medical bills, the healthcare provider will need to set up user accounts for any employee of the billing agent who will be allowed to submit Form HP1 on behalf of the provider. There is a provider role and a provider delegate role. The provider role is the actual physician, physical therapist, chiropractor, etc. The provider assigns provider delegates and billing delegates. Billing delegates can submit HP1s on the provider's behalf. Only providers can submit a PAR in OnBoard limited release. The provider delegate role can draft PARs, which must be reviewed and submitted by the provider role. Provider delegates can also draft Level 2 medication PAR escalations. Delegates can draft PAR escalations for provider review and submission to Level 3 for Medical Director's Office review. The provider has to actually submit the Level 2 and Level 3 review requests. Provider delegates can respond to ensure requests for information, but must be designated to do so by the healthcare provider from within OnBoard limited release. Lastly, the provider delegate can draft and submit requests for decisions on unpaid medical bills, Form HP1. If your specialty is not listed in the Who Can Do What table, and you need to submit requests for decisions on unpaid medical bills, you will need to register as a medical supplier. This includes ambulance companies, durable medical equipment suppliers, inpatient hospitals, laboratories, mental health clinics, outpatient hospitals, pharmacies, and psychiatric hospitals. To register as a medical supplier, visit wcb.ny.gov/medical portal. Under the Medical Supplier section, select Access and Administration. Next, select Requirements in the left-hand column. To begin the registration process, select Requirements, then select the Sign Up for Access to the Medical Portal button. Review the information on this page and then select Continue. The next page will require you to enter information within the Medical Supplier Information and User Information tabs. Enter the following information in the Medical Supplier Information tab: medical supplier type, name, NPI number, SEN, and address. The next tab, titled User Information, is where medical suppliers will enter user information. This will require the following: user or administrator, first and last name, address, phone number, and email. The User Information tab lets you add multiple users in one submission. Let's detail this process. Medical suppliers can register multiple administrators and users in a single submission. If you have an administrator who is already registered for the medical portal, they can add users within the medical portal administration. Medical suppliers registering for the first time should first register an administrator and then enter in the users of the system. To continue adding additional users, select Add User. Now that you know how to register administrators and users, let's detail these roles prior to you completing your registration. Before registering, it's important to know the difference between an administrator and user when you're registering for medical portal access. The online administrator will be responsible for keeping designated contacts and user information up to date. They will use medical portal login credentials to access the medical supplier administration application. There must be at least one administrator, and more than one is recommended. Online administrators can add or modify users to submit medical billing disputes, as well as add or remove other administrators. Online administrators can sign up and add users today. During the registration process, the registered user will be available in the medical portal to be assigned as a billing delegate. The billing delegate is the user who can draft and submit requests for decisions on unpaid medical bills. If the medical supplier uses billing agents to submit medical bills, the medical supplier's online administrator will need to set up user accounts for any employee of the billing agent. Now that you know how to register for the medical portal and have an idea of the roles within the system, we'll detail how to administer the system. These instructions apply to both healthcare providers and medical suppliers. The healthcare provider is the administrator. To assign delegates, the provider or medical supplier administrator will start by visiting wcb.ny.gov/medical portal and select Administrator Login at the top of the page. Next, sign in with your medical portal username and password. And note, if you've forgotten your password, you may use the ny.gov password self-service. If you do not remember your shared secrets, you may select the email activation option to receive a password reset email associated to your medical portal account. You will start on the medical provider administration page. On the left side, there is a column which shows each option for administration. Medical suppliers and healthcare providers will follow the same process. However, in this column, medical suppliers will only see My Profile and Billing Delegate. Let's start by selecting My Profile. Within the My Profile page, ensure that all information is correct and up to date. If any information needs to be updated, select the Modify My Data button at the bottom. Update information as needed, and then select Continue to finish. The next option is Billing Delegate. Select Billing Delegate. The delegates page will show two boxes. The first box lists users who are currently a billing delegate for you and can submit HP 1.0s on your behalf. Be sure to keep this updated and remove users who should no longer submit bills on your behalf. When a user is removed, they will appear in the second box, which lists users who are not selected as a billing delegate. The Modify button will let you update information for a delegated user as needed. The second box shows a list of users who are not designated as a billing delegate, but are registered in the system as a user for this provider. To designate one of these users as an active billing delegate, select the Add button in that user's row. This user will move to the first box here, and a confirmation pop-up will appear containing the changes. If someone needs to be a billing delegate but they are not in the system as a user in box 2, physician administrators can add a new user by selecting Add New User at the bottom of this page. The new user information is then entered. Once submitted, the Add User request is sent to the board for processing. Once processed, the user will receive a user ID and temporary password via the email submitted in the form. Select Continue. The last option in the main menu is Provider Delegates. This option will not be available for medical suppliers, as they will only be submitting Form HP 1.0s in OnBoard Limited Release. Provider delegates will be able to draft prior authorization requests, but the provider themselves are required to actually submit. This page is similar to the billing delegates page, with the first box showing a list of users who have a provider delegate designated to draft or submit an OnBoard Limited Release. Within the first box, these provider delegates can either be removed or have their information updated using the Modify button. The second box shows users who are registered in the system that can be added as a provider delegate. To add one of these users to be a provider delegate, select the Add button. This user will then move to box 1 with a pop-up confirming the change. If there is someone who needs to become a provider delegate but they are not an active user in the system, select the Add New User button. Enter the user information and select Continue. Once submitted, the Add User request is sent to the board for processing. And once processed, the user will receive a user ID and temporary password via the email submitted above. That wraps up our registration and user administration walkthrough. But before we move on, I'd like to share where you can go for more information and help regarding registration. For full details related to registration, access, and user administration, please visit wcb.ny.gov/medicalportal and select the links under Healthcare Providers or Medical Suppliers. For questions about the registration process, you can contact our customer service unit at 877-632-4996. And for technical assistance, contact WCB Customer Support at wcb.ny.gov. We continue to receive great questions from the healthcare provider community. Let's go over some of these new questions we've received. And just to note, we have documents that outline these FAQs and more that are available on the OnBoard section of our website under Resources. Let's start with this question here. As a DME supplier, will we be able to submit PARs as a delegate on behalf of the authorized provider? No, only the requesting medical provider can submit prior authorization requests. How is the denial of an MTG variance PAR, previously Form MG2, initiated? Insurers will receive an MTG variance and OnBoard Limited Release from the healthcare provider. After they submit the denial of the submitted variance, it will go back to the healthcare provider's dashboard to escalate to Level 3, the Board Medical Director's Office review, if desired. How will the arbitration process for Form HP 1.0 be handled in the new system? The arbitration process for Form HP 1.0 will continue using the same process as it does today. Now let's cover some other updates regarding resources and outline what's coming up next in the OnBoard project that the provider community should know. There have been recent updates regarding the New York Workers' Compensation Drug Formulary refill compliance. A new date has been set for compliance with the formulary for refills and renewals, being June 7th, 2021. The revised formulary is currently in the comment period. And for more information, see subject number 0461389. And as a reminder, OnBoard limited release will include medication PARs and will replace the current drug formulary. As previously mentioned, the Durable Medical Equipment, or DME, fee schedule amendments are currently scheduled to become effective on June 7th. Please review the subject numbers listed on your screen for more detail. And a recent update regarding our medical treatment guidelines. An amendment was proposed to incorporate updates to the New York Non-Acute Pain Medical Treatment Guidelines by reference. The notice of proposed rulemaking was published in the April 14th, 2021 edition of the State Register and is currently in the comment period. You can find more information in subject number 0461394. There will also be revisions made to mid and low back, neck, shoulder, and knee, and new MTGs will be created and used for traumatic brain injury and eye disorders. Training modules will be available on our website for both medical and non-medical professionals once the new and revised MTGs are implemented. So stay tuned for an announcement regarding this training once it's available. And last but not least, on the update front, the OnBoard webpage has been refreshed with a few new resources. There's a fact sheet highlighting what healthcare providers need to know, and a listing of frequently asked questions for the provider audience. You can also view a history of our recorded presentations and PDF copies of the slide decks as well. We encourage you to take a look at these resources and share them with your colleagues. In addition, the updated medical portal registration web pages that I spoke to earlier provides all the information you need to know to register and administer users in the new system. As we move closer to using OnBoard limited release, the board will be providing plenty of opportunities to receive updates and training. We'll continue regular webinar sessions like this one, and just prior to the system being available, we'll be delivering just-in-time training webinars to provide you with everything you need to know for day one. Guide materials and video tutorials will be developed, and website content is being continuously refreshed to assist you along the way. To stay in the loop on when training resources and other engagement opportunities are available, we urge everyone to subscribe to receive WCB notifications. If you didn't receive the invitation directly to this webinar today, please visit wcb.ny.gov/onboard and select the Get Involved and Stay Informed tab to sign up to receive email notifications to stay informed on resources and to register for upcoming webinar and training opportunities. So what should you do next to prepare? First, as we walk through today, you should review the medical portal web pages and register for access by visiting the URL shown here on your screen. You should conduct a review of any current systems and procedures to identify potential impacts. After going live with OnBoard limited release, the board will no longer be using paper for PARs, so please ensure your procedures are in place for day one. Lastly, we encourage providers to share this presentation information and registration web pages with your staff and any relevant vendors you have on file. That concludes today's presentation. It looks like we have plenty of time to answer your questions, but if you have any questions following this, please email onboard@wcb.ny.gov. To stay updated, we encourage you to visit the OnBoard webpage frequently. This is also where you can subscribe to receive OnBoard news straight to your inbox, as I just mentioned. These communications will not only feature limited release for now, but we'll be distributing information about the broader OnBoard project down the line. And again, for registration information, visit wcb.ny.gov/medical portal. That wraps up today's presentation, and I thank you for your participation and interest in OnBoard Limited Release.